Thank you, Chairman.
Thank you. Chair calls Candace Aylor and Valerie Romness. If there are any other witnesses that wish to testify, these are the last two registered witnesses, so please register in the hallway outside the hearing room, and I will provide another opportunity to come before the committee and testify when they are finished. Good morning, Ms. Aylor. How are you this morning?
I am wonderful. How are you guys?
Doing good. Doing great. Thank you for being here.
We're almost at the end of a short hearing.
Shorter than most of our
Yeah,
hearings.
shorter than most of what y'all have had. My name is Candace Aylor, and hopefully we'll get you my testimony passed around. It's kind of hard and I'm representing myself as both a parent, a nurse, and a certified family partner as well. It's kind of hard to try to fit what I want to say in a nutshell on this very huge topic. So I tried to be as concise as I could, but I do have a bit of information for you guys. So I have been a nurse in Texas for 15 years. I do have children that have had mental health struggles, and I will read some of my testimony just because I want to make sure that I don't miss a couple things. But I appreciate the fact that y'all have given a little bit of latitude this morning. My colleagues, my legacy colleagues that have been doing this for a very long time, I'm very happy to see them here. And I hope that I'm not saying the same things that they said today in 20 or 30 years. So hopefully I can cover the things that really should be covered and that y'all can hear them and how important they are to me as far as my experience and how these issues very deeply impact our families. Although I strongly support the needed reforms across the lifespan and the needs for parity and coordinated care across the spectrum of behavioral health care needs, including substance use recovery, I will focus the majority of my testimony today on the mental health care needs of children and families in Texas. While we all earnestly seek to discuss and understand the best way to ensure safe and effective treatment for those citizens struggling to maintain their mental health, tonight when we all go to sleep, children will be abused emotionally and physically and possibly sexually assaulted or killed by the people their families took them to for help in inpatient psychiatric hospitals and residential treatment facilities across the state of Texas, whether by seclusion or restraint, including chemical restraint, or by poor care provided by unlicensed and poorly trained staff. These injuries will go largely unnoticed, except for the occasional untimely death. I know these injuries occur through my own family's experience and the stories of countless families that reach out to me for solutions but never report abuse for fear of retaliation. While this very real and likely very common occurrence is the extreme, it is a symptom of many problems and gaps and failings of the system that serve the mental health needs of children and their families in Texas. Some of the things I recommend today as solutions will not be new information from those heard in invited testimony to this committee since February. And then a few items I do have not been mentioned. However, all of these recommendations are necessary to prevent further harm to Texans as well as for them to achieve and sustain recovery and for the state of Texas to be able to reduce cost and improve quality. So I do support the strategic plan that HHSC has drafted. I think that this is a great start. I think that it is comprehensive. It covers most of the main priority issues that families in Texas would consider important. Expanding community-based services will limit families having to access these non-evidence-based services of residential treatment. It will, they do talk about increasing and improving access to family partner services and peer supports across the lifespan. And so I also support that. In addition to that, that goal 8, is identified as something for a long-term plan. And I don't think we have time to wait for that. There's been codes in the Medicaid from CMS that are billable codes for peer services for a very long time. There's no reason that Texas should not pay those codes, that we should not allow our providers to bill for the services that are already being provided in the local mental health authorities, and to allow other entities to bill that service. These are proven services. Whether it's certified family partners, certified peer specialists, or recovery coaches, we know these services work. They will fill some of the workforce issues. They will fill so many gaps for just the individuals that are sometimes intangible. So the data is a little difficult to tell you why. When a mother or a father calls me and they just need to figure it out, and I don't give them a single solution, but they talk to me because I've been through this, and somehow they got to the solution faster, easier, and more confident just because they talked to me. I can't put a data point on that for you guys, but it is real. We all know it. They've known it for 30 years. They've known it before there was a code. So, and I really feel very strongly that now is the time. This session, this appropriations, this budget is the time to add the money for all of these peer services and get on with it. As far as trauma-informed care, I know that you've received lots and lots of testimony on trauma-informed care. I did give you a little, there's some little booklets she'll give you on that. I'm very familiar with trauma-informed care, but more importantly, trauma-informed system transformation. And I would highly recommend that in your research and understanding about trauma and trauma services and trauma responsiveness, that you understand that this is not an evidence-based practice. It's not a training we can give to some teachers or some CPS workers. This is a different way of doing business, and it should be from the top down within the HHSC agency. I've participated in a 4-year grant project called Texas Children Recovering from Trauma with the Department of State Health Services, and that was a project that was through the Mental Health and Substance Abuse Division, which now will be going under HHSC in a few days. I think that it would be wonderful to consider recommending that the agency create a division or a role specifically to focus on transforming our systems to be trauma responsive and trauma informed, and understanding that the people that are accessing services may not have a tangible diagnosis that they can put a label on so that they can give a pill for. What might actually be going on is that something happened and they need some help to process through that, and they need to be able to build some relationships within their community so that they can heal from that. And those are very different ways of doing business, and we need to support that from the top down. To increase safety and transparency for clients and their families in inpatient and psychiatric residential, I did talk about peer supports, which I believe it will add to that. I did talk about community-based services and the things that are included in the strategic plan. One of my greatest concerns is when I've talked with the licensing and regulation at Department of State Health Services for the psychiatric inpatient hospitals, I do not believe that we are doing a very good job of regulating these facilities that our state licenses, and that may be part of the problem. If you look at the way that DFPS reports what they find at a residential treatment facility, it is far different than what Dishes is saying they find and how often. So for 1 year, I can't remember the time frame, but it was a short time frame, less than a year. One facility in the state had, I think, 12, and I can give you all these numbers specifically, had 12 violations on the DFPS side. On the acute side of licensing for Dishes, in an entire year, there were only 4 violations reported on their site for the entire state. I cannot believe that there's only 4 violations I know for a fact that there are families of children who are injured in facilities in this state all the time, and we don't know about it. We don't report it to the public. So that's one of the things that should change. I'm almost done.
Is your recommendation there to have more consistency in how it's evaluated, or to change the agency doing the evaluation, or what specifically do you think would be the best resolution?
You know, the people that are doing the evaluations, Patrick Waldron is one of those staff members. I can't remember the other off the top of my head, but I feel like they have a desire to keep Texans safe, and they are good bureaucrats that know the constraints of what the legislature has told them they can and can't do. I haven't been able to dig into it enough, but I think they're probably properly placed. I think the task is properly placed. I think greater transparency does cause institutions to want to comply. And I
I'm
think...
getting you some water. Here, we'll get it to you.
Thank you very much. I am a talker. I think that I think that what we're doing right now through Senate Bill 325 from the 79th legislature was to report restraint and seclusion. I don't know that that's reducing it. And so some of my solutions to that would be, and I know that this is probably not going to be a popular suggestion right now, creating another certification. Mm-hmm. I know. But we certify nurses' aides. I know this because I've been a nurse for 15 years. The people that support me that are working on my license in a hospital, I know are certified. When I work in an outpatient or inpatient psychiatric facility, which I have in this state, the person that's working on the floor the majority of the time with the patients has a high school diploma and a background check. That's it. There is no other qualification for that job. So whether or not it's a certification or whether or not it's more strength built into the regulations for the facilities, we've got to get quality people on the ground. I think that may be a reason why some of those people don't get reported to the abuse and neglect registry as well. So in addition to that, one of the problems that we're facing is that we're contracting with entities that are known to abuse children because they decrease their staffing and they don't give good training. And that is a corporation that is known across the nation. It's one of the largest. It's called Universal Health Services. There was a Supreme Court case against them this year that they lost. That was related to a suicide of a patient. There are federal investigations into violations of their facilities all over the country, and the tide is turning. And this corporation should no longer be able to make billions of dollars off the backs of our families. One of my family members was in one of their facilities, was injected 9 times in one day, restrained 20 times over a 3-day weekend. And it was clearly stated in her care plan that that was never to happen, that she was not to be injected, that it was taped to the front of her chart. The effect that had on her and our entire family remains today. So there's a reason why I have a passion for this, but I don't come to you with my own personal experience as my only knowledge. I get calls from families all the time. So I know that you're asking how to do it. I know that you acknowledge that this is something that we should look at. So I think that it's properly placed, and I think that we could strengthen the regulations within where it is placed and increase the transparency, and that could help. Okay. I did want to get to the I won't harp on not being invited to testify in invited testimony since you're giving us latitude today, but I would appreciate that the committee and each committee member in your other dealings throughout your careers in the House or Senate, if you go to the other side, but wherever you're dealing with these issues of mental health, there are leaders that have risen to the top. We are advocates that are not paid in an advocacy organization. We are incredibly knowledgeable, like Patty said. We have a perspective on this that cannot be compared with an education. And we do have an organization. That's one of the things that I included is the Texas Family Voice Network. We're working on making that an actual entity, but for now, there is a collective of family leaders across this state, from Rural Children's Initiative, from El Paso, from Houston, Dallas, Tarrant. I have families. We have families in this network from across the state, and we would appreciate being acknowledged as the subject matter experts that we are, and occasionally being invited to actually give you our full attention to topics related to mental health. My final comment is on policing, and I know that this may sound like, well, this belongs in a criminal justice hearing, but I feel like there's an appropriate recommendation, an appropriateness to collaborate between local mental health authorities and the law enforcement in their communities. Representative Rose, I went to El Centro College. I worked at Charlton for many years and healed that community. And I have watched as my community now here in Austin has suffered greatly. In February, a minor boy, 17-year-old named David Joseph was killed, running down the street, 10 o'clock in the morning naked, shot within seconds. And clearly in crisis, whether or not he had a mental health history. I have had, as a nurse at Kerrville State Hospital, patients running full on at me, no clothes, in complete crisis. I was not scared of them. I understood I did not need to be scared of them. There was no reason for me to put my hands on them or to present myself in a threatening manner. And because I didn't, they never touched me, they never hurt me, they never hit me. They knew that they were safe with me. There is got to be a way that we can collaborate with our police officers to not only help them understand this in a way, because I've read through their mental health officer training, and I think that our local mental health authorities could probably do a really good job of collaborating with whoever's training that training and present it in a better way, because it's actually got some good pieces to it, and it recommends having peers be part of the training, which I know they don't do. So not having just law enforcement train that training and collaborate. And then also, we need to be taking care of the officers as well. One of the things about being trauma-informed is understanding that there is a possibility of secondary traumatic stress. And our officers are in stress, high stress, all day long, and we expect them to be perfect. We expect them to be stellar. You're going to, you cannot waver. And it's not fair. And, I've talked to the police chief here in Austin. I'm sure the police chiefs all over the state would say, oh, well, we have, this service where they can go and talk to somebody. Here in Austin, the one that they can talk to is also the one they go to for discipline, and I imagine that that's probably consistent across the state. So maybe they need to be able to go to talk to somebody in our local mental health authority that understands trauma-informed treatment, that can help them process through things without having the fear that that's going to impact their job, and not having the stigma that goes with going to that person's office.
It's a good suggestion.
I've since David died, I have kind of gone into hyperdrive and trying to understand how in the world having my own experience, having had somebody run at me like that, and not having been fearful, I had to understand not only how that happened, but how we could make sure it doesn't happen anymore.
Yeah, I think that's a good suggestion. I think across the state we've seen through our committee's work and some of the testimony that not all law enforcement and LMHAs in the same community get along. Historically, they don't speak the same language. They don't always have the same goals, and sometimes they've expected things from one another that were either not realistic or tough to accommodate, and so it's created some barriers or resentment or just lack of communication. But if you peel that back and really get past it, you can see there's tremendous opportunity to help communities if they do work together. And I think in many cases they are. So I don't want to give the impression that that's not happening. I just think that in some cases, historically, that's been a challenge. And so that's the type of suggestion that would help break down some of those challenges and hurdles to just open some lines of communication that ultimately will benefit the officers, will benefit law enforcement. In turn, that benefits the community, and LMHAs and law enforcement can find ways to work together, I think, for the benefit of their local communities in really positive ways. So that's a really good suggestion. And I heard Representative Murr, somebody hit a button, so I just figured you had a comment or a question.
Mr. Chairman, I just want to comment, Ms. Aylor, the materials that you have provided the committee, I want to commend you on the outline format. I think it's superior.
Thank you.
And I think it does a very commendable job of succinctly pointing out not only the issues, but your serious recommendations for policy change. And I would hold this up to anybody that walks into my office that wants to come and talk about a mental health topic. That is a very effective means as a tool for presenting. So I'm going to use your paperwork as an example in the future.
Thank you very much.
It does help saying what you know and what you don't know. So I like that. So thanks for breaking it down that way. It's easy to read. We appreciate it. Members, with any additional questions for Ms. Aylor? Really do appreciate your time. I know it's not easy to break away and get here, so thank you.
I very much appreciate the latitude given today, and thank you for the opportunity and the water.
Yeah, absolutely. Anytime. Mr.